The roads in Colombo were busier than usual today as many private vehicles and public transport made their way to the country's commercial capital. This is the first time in nearly 6 months that interprovincial travel was made possible. However, the police urged the public intending to cross provincial borders to do so if travel is absolutely necessary. Meanwhile, with Deepavali falling on this Thursday, there is yet another possibility of a long weekend. In view of it, the Ministry of Health emphasized the importance of exercising extreme caution when making trips. The request is to choose less busier travel destinations and not to abandon the health and safety guidelines. Adding on to these sentiments was the Sri Lanka Medical Association, which said that it appears that people believe the COVID virus is no more.
It appears that the numbers of cases that has happened over last week is 12.2% more than the week before. The number of deaths over last week had been 9.1% more than the deaths that had happened 1 week ago. When we consider the situations that happen in UK, Israel and in other countries, it is quite possible that we may get another surge, not to the extent that we had, but then it's possible that we could get clusters. And particularly, it may be possible that there will be patients, though the deaths and the severe cases might become much lower than previous situations. So therefore, it's important that we as people avoid all possibilities of contracting the disease. Now, if we have contracted the disease and if we have got both vaccinations, it's likely that we may not suffer a severe disease or that we might not die, but then it's possible that we transmit the disease to others who are at home, our elderly with immunocompromised status, and it's the person who is at home who has not come out that might succumb to the illness.
On the country's vaccine front, Sri Lanka began rolling out booster doses for frontline health officials, the Triforce's personnel, and members of the tourism industry today. In addition, health experts said that according to data, people who receive the Sinopharm jab should receive a booster dose before others as the immunity of such persons wane after 3 months.
Sinopharm එන්නත පළවෙනි මාස ටික ගත්තම යම්කිසි ආරක්ෂාවක් තිබුණට පිටරට දත්ත අනුව සහ ලංකාවේ මහාචාර්ය නීලිකා මලවීගේ දත්ත අනුව මාස 3කට විතර පස්සේ ආරක්ෂකතාවය අඩු වෙනවා කියලා පේනවා. හැම වයස් කාණ්ඩයකම මේක අඩු වෙනවා කියලා අපිට දත්ත පේනවා. ඉතින් මේ දත්ත සේරම ගත්තම අපිට පේන්නේ Sinopharm එන්නත ගහපු අයට බූස්ටර් ඩෝස් එකක් දෙන එක මම හිතන්නේ නුවණට හුරු. Pfizer එන්නත් දෙකක් ගහපු අය තුන්වෙනි මාත්‍රාවක් ගහන එක නුවණට හුරුයි. හැබැයි ඒක මාස 6ක් 8ක් වෙනකන් කාලයක් දික් කරන්න පුළුවන්. Sinopharm එන්නත ගහපු අයට ඊට වඩා කලින් දෙන්න කියලා මම කියනවා.
On the child inoculation front, President of the Sri Lanka College of Pediatricians, Professor Shaman Rajendrajit, meanwhile says that data on child vaccinations around the globe is still lacking.
Now, the data is coming from China, saying that this was a paper in the Lancet, one of the most respected journal, saying they can vaccinate children from 3 to 19 with Sinopharm vaccine and they have good protection at the initial stages. The data has been already published. In addition, USA and Canada, they are considering giving 1/3 of the usual dose of Pfizer biotech vaccine to children below 12 years. We need to wait and see how things are progressing. So data is not enough. Now we have this committee who is very closely monitoring what is happening around the world because we want to be very proactive in this process of getting our children vaccinated. We constantly have dialogue with the Ministry of Health, ACCD, so that we are watching very carefully, and as soon as we have more data, we just can go ahead and do that.
In the meantime, reports of digital autism have surfaced, especially after children were pushed towards electronic devices for educational activities following the island-wide school closure.
We believe it is very important to physically open the schools and continue school education in the normal environment as much as possible, simply because the screen time is one of the problems that we have encountered during last 2 years. Too much of a screen time would cause a lot of medical as well as psychological issues in children. The education in school is not only subject matter, it consists of so many things, interaction between children as well as teachers, which teaches them a lot of positive things. Interaction with other children will give them social benefits. These are very important things. In addition, it is vital to have extracurricular activities in the school going.
කට උත්තර නැති වෙන්න කලින් සිග්නල් ඩීප් ක්ලීන් එකකට මාරු වෙන්න.